Good afternoon, and thank you for the opportunity to join today's discussion. My name is Rob Buelow, and I'm the Vice President of Impact and Education at Everfi. My organization, based here in Georgetown, is the largest provider of online education uniquely focused on addressing the most intractable issues facing our country today, including the pressing concerns of opioid addiction and overall prescription drug misuse and abuse. At Everfi, we utilize a prevention-based public health approach. Whereas the field of medicine is about treating individuals after they've gotten sick or injured, public health is about preventing populations from getting sick or injured to begin with. Many of the efforts to address the opioid crisis follow the medical model, focusing on overdoses and addiction. While investments in treatment and response programs are necessary and life-saving, we will not get ahead of this issue by distributing Narcan. Everfi believes that schools and organizations should shift the balance to prioritize primary prevention, keeping individuals from initiating opioid misuse or abuse to begin with. Research shows that these upstream prevention initiatives can be effective in shaping behavior when they incorporate evidence-based approaches. Such approaches engage the healthy majority who do not misuse or abuse opioids. They challenge misperceptions about the prevalence and social acceptance of prescription drug misuse, and they incorporate strategies designed to help individuals recognize the signs of abuse and assist someone who may be struggling with addiction or at risk of an overdose. That said, it's difficult to do good prevention education at scale, and even more challenging to do so in a way that isn't cost prohibitive. Online education is increasingly being utilized to deliver prevention strategies in a scalable way, as it enables schools and organizations to improve knowledge and skills at the population level. But many schools lack the resources in both time and money to deploy these types of solutions. At Everfi, we've created a blueprint for addressing this challenge by developing a first-of-its-kind public-private partnership, the Prescription Drug Safety Network. This network is a national coalition of healthcare organizations, pharmaceutical manufacturers, distributors, pharmacies, foundations, and state leaders committed to empowering Americans to make safe and healthy decisions about prescription medications. Working in collaboration, these committed partners allow schools to implement our evidence-informed online solutions at no cost. With support and funding from members of the Prescription Drug Safety Network, we are deploying our courses in schools across the country, including some of the most at-risk communities. Since the launch of the network in 2017, nearly 200,000 students across 1,500 high schools and 70 colleges and universities completed our prescription drug safety course. Online trainings like ours also provide the ability to collect data through pre- and post-course surveys that provide real-time insights on students' knowledge, attitudes, and behaviors. This data can be invaluable in informing and strengthening current initiatives, particularly those aimed at correcting social norms. Students often overestimate the negative behaviors of their peers, like how many of them misuse opioids, and underestimate their peers' positive behaviors, like willingness to refuse a prescription drug if offered. Social norms data like this from our prescription drug safety course showed that 70% of high school students would step in to discourage someone from sharing or selling prescription drugs, but only 51% felt their peers would do the same. Efforts aimed at closing that 20% gap between actual and perceived norms will go a long way in creating healthier school communities where students feel empowered to speak up, take action, and look out for their classmates. It's also worth noting that more than 70% of learners reported that the prescription drug safety course helped them identify signs of abuse and made them more confident intervening when they feel a friend may be misusing prescription drugs. I'd like to conclude by acknowledging that our ability to efficiently reach increasing numbers of students through evidence-informed, population-level prevention and to measure the individual and community-level results of such programs would not be possible without a powerful network of policymakers, nonprofits, private sector organizations, and educational institutions that are committed to collective impact. However, these efforts must be supported by other crucial elements of a comprehensive prevention strategy, including rigorous strategic planning, effective public policy, community development, and ongoing investment in treatment and response. Thank you for allowing me to share my perspective and for your continued leadership and commitment around these critical issues.
Thank you very much. Mr. Mitchell?
Anything you want to add, Mr. Buelow?
I agree with all of my fellow panelists that recovery works, treatment works. But when you look at statistics showing that 90% of addictions are starting with teenagers and young adults, how are we thinking about transformative impact, not from how do we keep drugs out of, or remove drugs from people's lives, but actually keep them from being there to begin with. And I think looking at the funding and seeing less than 20% of the allocation of dollars actually going to primary prevention and root causes and actually keeping people from misusing and abusing prescription drugs to begin with, I think that that's really significant. And I think that the percentage of dollars focused on strategies in that prevention goal on harms and risks of prescription drugs and not on skills and giving people the language to be able to refuse an offer of an opioid or to create a norm within their community to say, hey, it's not cool if you're using medications that aren't yours, or even to get more upstream than that and look at the motivations as to why young people are choosing to misuse or abuse prescription drugs, thinking about the fact that kids today are lonelier than ever. They are socially isolated. They're disconnected from peers. They are sad. They are depressed. They are anxious. They are hungry. They are lacking housing. And how are we putting in educational interventions that are really getting at the whole person and supporting their decisions to be able to use prescription drugs appropriately when they are prescribed and avoid misuse and abuse within their communities and create a norm that just says that that's not acceptable to who we are?
You know,